Okay, today we're going to run through stage 1 core restore mummy MOT system exercises. So the first phase, generally you'll start on the plinth, on the mat, before you get up into more functional movement. So we're starting with just getting the breath connected to the pelvic floor and the deep tummy muscles on the out breath. So you want to take a breath in, Emily. Good. And then on the out breath, draw the pelvic floor up and the tummy in without any movement in the pelvis. So just getting that connection. So close your eyes for me, Emily. Again, when I'm getting the patients to do these exercises at home, I encourage them to do them mindfully, slowly, and with their eyes closed so that they can really focus on their balance and the right connection with the muscles. Good. And again, breathe in. Breathe out. Good. Now we're going to start into exercise 2, which is just the pelvic tilt. I'm going to get Emily to put her hands on the wings of the pelvis there. And I'd encourage you to do that with your patients as well, so the patient gets to feel from symmetry point of view. And on that out breath, flattening down nice and slowly and releasing. So we're just going to do that 4 times. Down, shortening the distance between the ribs and the pelvis, and release. On the out breath. And again, encouraging the patient not to try too hard. If they try too hard, you'll often then get bulging and doming through the centre. Progress that up into your bridge. So on the out breath, rolling up. With Emily, I'm going to get her to now monitor her ribs, because she has some rib flare there after the pregnancies. And then on the out breath, coming down 1 vertebra at a time, slowly, and release. And again, rolling up. Emily's good at keeping her knees here hip distance apart, and rolling back down. If she wasn't, we would put a ball between the knees. 1 more, coming up. On the out breath, slowly. You, as mummy MOT practitioners, really make sure that on the way down, she comes down nice and centrally, and any shifts and drawing off to the right or the left side, try to help her keep central. Good. Now we're going to pop ball in between the knees. We're going to start to use the adductors to help fire up the pelvic floor and the deep tummy muscles on the out breath. Good. And again, not trying too hard. So just getting all that anterior chain, getting your adductors linking with the pelvic floor, that's beautiful. And the deep tummy muscles, no doming. Ribs down, shoulders down, long through the neck. Perfect, Emily. Now roll up into your bridge and do the same thing up in the bridge. Rolling up slowly. Once you're there, check that the balance is equal underneath the right and the left foot. When you're ready to go, 4 times, squeeze, stay up there, sorry, squeeze the ball for me, and release. 1, 2, 3, 4, perfect, and roll back down. 1 vertebra, right? Keep that tailbone tucked under until the end, so you get nice movement through the lower back. Well done. Then, bring the ball to 90 degrees. Shoulders down. Neck nice and long. Remember, preset through your centre before you do the leg slide. So take a breath in and breathe out. Pelvic floor up, tummy in, and slide right leg away. And release. And then alternate sides, right and back to centre. And then the left and back to centre. Change sides. Again, here you can start to work out, watching this exercise, which sling is more stable anteriorly and around the pelvic area, which side she may need a bit more guidance on as she develops through the other stages of the core restore program. Good. And back to center. And rest. Well done. Okay, we're going to then do next exercise, single leg to tabletop. And then what we want to do is again start to really stabilize through her center and get her to just drop the heel down. So recruiting through the TVA and the other abdominal muscles as she controls that. On the out breath, the leg drop. Again, start with your patients to make sure that they're aware of their alignment and their breath and their recruitment through their centre. And again, sometimes you just have to give them a little bit of assistance to keep that alignment initially, and back, down. Then we're going to hop on, just lift one leg up rather than the two legs, and then the other leg. Then I'll slip this up. So a bit like what we did with the ball, okay? Rather than squeezing the ball, you're now going to work more your external hip rotators and up into your glutes, posterior part of your body and into the posterior part of the pelvic floor. So 4 times, push out on the band and release. So what's happening now with Emily as well, she's already recruiting, you know, subconsciously, unconsciously here before she fires up her abductors and posterior chain there. Good. Nice. Then roll up into your bridge. Okay. Still and steady before you start. And then 4 times. 1, 2. So she's getting a good preset on that out breath before she adds any load. Good. And roll back down again. And release. She's a little bit tighter on the right there, so we'll have to keep an eye on that as we go through the exercises. Okay, let's turn you over onto your side now for me. So often when you put the moms over onto their side, even, you know, just lying on their side isn't particularly stable for them. So you have to help line them up. Again, the ribs down, the feet just in front. Get them to put their hand up in the air, get them to close their eyes and see how steady they are. So Emily's pretty steady there now. Get those ribs down. So then, I'm going to give you the ball there in front, so you can just stabilise there a little bit. We want to keep the shoulder blade down. So again, on the in-breath, fill up the upper rib cage there, and on the out-breath, draw the tummy in and just lift the top leg. So you're just going to do that 4 times, staying still and steady. That's your leg. And you could then move on to a double leg lift, lifting up. Again, mindful about any tension or bulging. At this point, the linea alba, the tension through the centre, you'll be getting good load transfer. So you're starting to bring in your obliques on top of the TVA. And rest. Well done. Come over onto all 4s. So on all 4s, make sure again, before the mum does her exercise, that the alignment just goes nice box shape, hands underneath shoulders, knees underneath hips. On that out breath, drop into your cat stretch. Release the head and really scoop the tummy muscles in, wrap around your rib cage there, and back down. And again, up, cat stretch, and back down. Follow that with the shell stretch, bottom back on your feet. So here you're getting a combination of nice movement through the spine with the cat stretch, and here a nice stretch through all the muscles, the back of the body. And again here, use the breath in different positions. Fill up the back of the body now with a nice breath. Breathe in, and then on the out breath, draw the tummy muscles back towards the spine. Getting a nice stretch, releasing the head. And back to centre. Onto all 4s again. This time you tuck the toes under, cover the knees. Again, check what's happening with that linea alba. Check that there's no bulging and dowing. You want to encourage strengthening across there and nice equal recruitment through the abdominal wall. And then come into down dog. Nice for all the organs. And just again, If Emily was to dome, then this would not be an appropriate exercise for her at the moment. But at the moment she scoops in nicely, and it's a nice stretch to be doing postnatally. And come back down. Well done. Bottom back on your feet. Release. Hands by your side. Come into the child pose. And come. Well done. Thank you.